Hello friends, let us now learn some important points about scar formation. So in the scar formation, scar is right. So we have already seen some important points about scar, where you see in the scar, it mainly occurs in the maturation phase of wound healing. It mainly occurs in the maturation phase of wound healing. Here you will see that there is collagen deposition is there, and there will be contraction of wound occurs. Okay, so one important thing is we will have to see the types of scars. These scars can be atrophic scar or hypertrophic scar, or there can be keloid. Okay, so first we will learn each of them in detail. Okay, first we will learn about atrophic scar. So in the atrophic scar, this atrophic scar is pale, flat and stretched, and here you will see presence of it is mainly seen on the back, or it is seen in areas of tension. Here in this atrophic scar, you will see that there is trauma is present, especially in the thin dermis and the epidermis. So this atrophied scar has to be excised, and you will have to do resuturing should be done. So this atrophic scar is pale flat scar which is seen, right? Then after this we have the next type of scar, which is hypertrophied scar. Now in the hypertrophied scar, here there is excessive scar tissue is seen, but this does not go beyond the margins of the wound. If this is the wound, it does not go beyond the margins of the wound. So in histology, you will see presence of excessive collagen will be there, and you will see presence of excessive vascularity will be there, and this actually improves spontaneously with time. Treatment is, you can give pressure therapy can be given, and if you wanted to give, you can also give intralesional steroids can also be given in these patients. So this is about the hypertrophied scar. Then we have the next type of scar, which is called as keloid. In this keloid, here also there is excessive scar tissue, but this will go beyond the margin of the wound. Here this is associated with increased levels of growth hormone, deeply pigmented skin, or it is also seen in certain individuals who are genetically predisposed. And this keloid is mainly seen in certain areas of the body, especially above the clavicle, upper extremities, trunk or face. You will see this keloid. So if you see the histology, you will see that there is excessive collagen is present, and you will see there is hypervascularity is also seen. And here there is mainly disorganized collagen is seen, that is type 1 and type 3 collagen are seen which are disorganized, and you will see presence of large thick bundles of collagen are also seen here, right? So keloids rarely regress with time. We will have to give treatment. The first line treatment for keloids is we can give silicones with pressure therapy should be done, along with intralesional injection of triamcinolone can be given. Then if there is any refractory cases which do not get treatment with pressure therapy or triamcinolone and silicones, in those refractory cases we will have to do excision, and we will have to give post operative radiotherapy should be given to these patients. So this is about the hypertrophied scar and keloid. Thank you for watching.